Hello everyone, good morning. I am Dr. Nisha Bhatnagar from AVEYA Fertility and IVF Center. Welcome to our YouTube channel. Today we are going to talk about repeat implantation failure. So many times I have patients visiting me with the same question. Ma'am, my embryos were perfect. They look very good. Why didn't they implant? This is a doubt in the mind of most of the couples going for IVF, especially when it becomes multiple IVF failures. They want to know that what went wrong. So today we are going to talk about this only, repeat implantation failure. When our doctor says that they have placed around 3 times beautiful blast into the uterine cavity and still the pregnancy doesn't happen, we say that it is repeat implantation failure. Usually when a couple go through repeat implantation failure, it is a natural tendency for the female to think that maybe my body is not strong enough, maybe my uterus is not able to hold the embryo, maybe it is rejecting it. Sometimes some females even say that, ma'am, what is happening? Why my uterus is killing my embryos? None of these statements is correct. It's not that. Sometimes it happens that your body may be rejecting it, but there are certain reasons for that. It's not always true. So today we will talk about those reasons only. Why multiple implantation failure happens. I usually try to explain this in terms of a plant growing. When we talk about a plant, we have 3 things in mind. There has to be a good seed, there has to be a good soil, and there has to be a good environment. So the same way when we talk about embryo, when we talk about a living child, there has to be 3 things. There has to be a good embryo, there has to be a good uterus, and there has to be a good environment. That means the body of the female. So now this is the model of female genital tract. This is the vagina, this is the uterus, these are the fallopian tube, and this is the ovary. I think all of you know that the tube picks the egg from the ovary, the sperm reaches the tube, it fertilizes in the middle of the fallopian tube, and then the embryo starts developing, traveling from the fallopian tube to the uterus. This takes roughly around 5 days of time, and when the embryo reaches the uterine cavity, there is a sort of dialogue happening between the embryo and the uterus and the endometrium of the uterus. So what is this dialogue? Normally what happens is that when the embryo reaches the uterine cavity, it attaches itself to the endometrium, and there is a sort of secretion of series of enzymes which eventually leads to the embryo being invaded into the uterine cavity, the endometrium covering it over the embryo, and then the embryo starts developing. It invades into the uterine cavity, the endometrium overlaps it, and then the embryo starts growing inside. This is called the embryo and the endometrium talk. This dual talk, it is very, very important. Let's talk about the embryo first. So the embryo is formed by the egg and the sperm. First of all, if there is any problem with the egg or the sperm, the embryo doesn't reach a blastocyst stage. If you have got a blastocyst transfer done, the blastocyst was looking very good in the lab, then you need to understand that when we select a blastocyst, we select it on the basis of appearance only. It is looking very good, it is expanded, the inner cell mass is looking very good, the trophoectoderm is looking very good, but we don't know about the genetics of the embryo. We don't know about the chromosome structure of the embryo. So if you have had multiple failures, the most important thing which is needed to be done is number 1, a blastocyst transfer if it is not a blastocyst transfer earlier, and number 2, the genetic testing of that blastocyst, that is called PGS for aneuploidy. So if you have multiple failures, you should opt for the genetic testing of the embryo if you still want to go for your own egg and your own sperm. The reason why we sometimes suggest when a poor reserve is there or when the count is low and the motility is low, we suggest to go for donor egg or donor sperm. It is just to overcome this factor only, that if there is any genetic problem in the embryo, it may not implant. So another most important thing for recurrent implantation failure is uterus. When we talk about uterus, we talk about 2 things. One is the anatomy or the shape of the uterus. Second is receptivity or functionality of the uterus. Let me tell you one by one. So first is anatomy or shape. What do I mean by that? When the female is developing, when she is in her mother's womb and she is growing as a girl child, the uterus is formed by joining two tubes. These are called Mullerian ducts. So when these two tubes fuse, the middle part of both the tubes that get dissolved and it forms a big cavity. So if there is any problem in that, a remnant of that part is left, it results in a septum in the uterus. Just to understand, like a big cavity, it is divided in the center by a small wall protruding in between. So if there is any septum, it is actually a fibrous tissue. The embryo cannot implant on that. In that case, it results in recurrent implantation failure. Or if you have had any previous infections like tuberculosis or genital tract infections, sometimes there are some flimsy adhesions in the uterine cavity. It's like sort of a spider web inside the uterine cavity. In these cases also, the embryo cannot implant. There is another condition called Asherman syndrome, where the uterine cavity is fused with adhesions. All these things needs to be corrected before we put the embryo back inside. This can be done with a simple test which is called hysteroscopy. Now coming to the functionality of the uterus. When we talk about the functionality, you need to understand that uterus is an organ which is receptive for a very short duration of time. It is called window of implantation. Before that or after that, if we transfer any embryo, it is not going to implant. This window of implantation we calculate on general basis, and it is from 19th to 24th day. But I have seen cases where this window of implantation is either less or more. So if you have had multiple failures, you need to check what is your exact window of implantation. Along with the window of implantation, there are other important conditions. For example, recurrent infections in the uterine cavity leads to endometritis. So the normal flora, normal bacterial environment of the uterus is disturbed. In this case also, the embryo cannot grow further inside the uterine cavity. There are a series of tests which you can do to find out that whether your uterus is accepting the embryo or not. Now coming to the third thing, which is the immunological factor or the environment, the body. So if you have everything is perfect, your embryo is very good, your uterine cavity is very good, the endometrium lining is very good, the blood flow is very good, and even the window of implantation is receptive. Still, sometimes the uterus rejects the embryo. It doesn't grow further. This is some sort of autoimmune disorder is there. So there are various types of immunotherapies available. We give you certain IV infusions, we give you certain drugs, we sometimes add certain steroids to increase the receptivity of the uterus, to increase the receptivity of the body, and the embryo is not rejected. If it still doesn't improve, you have undergone all these three things, but still there is no result, the last step is to go for surrogacy. Surrogacy means that if you have good embryos, you might need to implant those into the surrogate. This is the only case where the body is rejecting and the uterus is the problem, so you need to go for surrogacy. If you have any more questions regarding this, or you want to understand something else about this, please feel free to contact us at the given numbers. Thank you so much.